Thank you for your interest in the GradFUTURES Fellowship Program. This program offers highly curated experiential opportunities for graduate students with organizations who have partnered with the graduate school at Princeton University. To be considered, applicants must be currently enrolled Princeton graduate students in good academic standing who meet all of the application criteria. For more information about the program features and to view opportunities, please visit gradfutures.princeton.edu/gradfuturesfellowships. The following is a recorded information session with a host organization.
Thanks, Eva. Welcome, everyone. And again, Happy New Year. We're glad you're here. And thank you for turning your cameras on. We know sometimes you might not be in the best position at home to do that, but it's always great to have a camera on and be able to see your faces, and it makes it a little more personal. So we wish we could be in person, but we continue to work remotely. So it's always great to remember our grad alums who kind of forged the way, and now we're making a lot of these opportunities more formal and partnering with amazing organizations like BioNJ to really bring these opportunities to the forefront for grad students. I believe John and I met, I forget what year he was in grad school, but started talking about different kinds of paths. He was an English PhD. He'll tell you more of his story, but really found these opportunities on his own. And we're really excited now to, again, formalize these partnerships and be able to bring them to the forefront for grad students. So I'm going to kick it off to Debbie Hart, who is the head of BioNJ, and we're going to hear from her folks and then hear from John, and then we'll have lots of time to answer your questions about this opportunity and anything you want to ask. So Debbie?
Great. Thanks so much. Thanks so much, Amy. And thank you to Eva for getting us here today. And it's so exciting to see John Ruland again. I've seen him on and off over the years, but we were reminiscing that it was 2012 when he did his fellowship with us. And it's hard to believe that much time has gone by. His career has gone exceedingly well, as you'll hear. But again, it's good to see John, and it's always good to be with my colleagues, Randy Bromberg and John Slotman, who you'll hear from, and to meet the students on the line. So very briefly, BioNJ, we're the Trade Association for Life Sciences in New Jersey. Our tagline is because patients can't wait, because they can't. Everything we do sort of centers around that and making sure that medical innovation is happening in New Jersey in a very robust and meaningful way, and that patients can access that medical innovation. So, and in fact, it is happening in a meaningful way. In fact, New Jersey represents last year, Randy just pulled this stat, I think in time for this meeting, that more than 40% of all new FDA approvals came from companies with a footprint in New Jersey. And we're very proud of that, of course. And it came from companies large and small. So there's a very long tradition and history of the industry, doing well and doing, creating products and getting approvals, and having some very significant firsts. And you see 4 of them right here on the screen. So New Jersey through Medarex was the birthplace of immunotherapy. In Novartis, we had the first ever CAR T cell therapy, and really that laid the groundwork for a burgeoning industry that is largely, in particular in manufacturing, is largely centered in New Jersey. Then Pharmasset was the creator of the cure for hepatitis C. And in fact, I love this data point, and it's so relevant for the group on the line here, that actually happened, if you all are aware of the Princeton Biolabs facility that is in Princeton, that is a partnership between Princeton University and the renowned Biolabs organization. It happened right in that space. So I've told the folks there that they should really get some sort of a big placard or perhaps a bronze plaque to put in the floor there as people walk in the door. But anyway, we all know it and we celebrate it. Also, Aprecia Pharmaceuticals had the first FDA-approved 3D printed drug just a couple of years ago. So New Jersey, clearly, hopefully you're getting the picture if you didn't already know that New Jersey is a life sciences powerhouse. And just a few data points on exactly why we feel free to say that. So it's first of all where, Johnson & Johnson was founded, the first pharmaceutical company way back. And also, based on that humble beginning, not so humble anymore, there's $47.5 billion in economic impact by the industry with about 3,300 life sciences establishments. Many of the large R&D companies are here. 27,000 life sciences graduates with a concentration of scientists and engineers per square mile, more than anywhere else in the world. New Jersey leads the nation with 139 FDA registered biopharmaceutical manufacturing facilities, some of them the cell and gene therapy manufacturing facilities that I mentioned in a previous slide. More than 25% of all cell and gene therapies in development are being done in New Jersey. Also, there are more than 500 companies who are working on COVID-related programs around the world, on 780 plus programs. And more than 70 of those companies are in New Jersey. So we're, as you can imagine, very proud of that. In fact, Rutgers had the first COVID-19 saliva test approved, very early out of the gate. So of course, we're proud of that as well. And now Pfizer, which is one of our largest members, of course, brought about the first vaccine. So I mentioned that New Jersey is a hub for cell and gene therapy. There is so much going on in this space, and it's been a very steady build over the last few years since I mentioned that Novartis approval. Celgene's had an approval now acquired by BMS. And many others. So it's an important and growing area of the industry, and again, specifically in New Jersey, with an economic impact, a growing economic impact. So New Jersey has a strong foundation for startups. There are just so many things going on. I mentioned the Princeton University Biolabs collaboration. The Commission on Science and Innovation and Technology is funding companies, and I sit on the commission board. And in fact, there are lots of very exciting programs to be launched in the near and longer term coming out of there. That's on a steady build at the commission. The merger of Rutgers Health and RWJ Barnabas Health is helping to create entrepreneurship at Princeton. At Rutgers. Princeton, certainly what you all have done just in the last couple of years in this space, your commitment to being a part of the ecosystem, helping companies grow, et cetera, has been really significant and very important, and will increase over time. The recent announcement by the governor, I'm sort of skipping around here, but by the governor about the hub that will happen in New Brunswick. And it's a collaboration between Princeton and Rutgers and others where you will have a very significant presence there. So we are very excited about that. Again, that will help to facilitate startups and entrepreneurship and the continued growth of the industry. So our mission at BioNJ, I mentioned, because patients can't wait, and our mission is to make sure that New Jersey is a robust life sciences ecosystem where, again, innovation is happening and patients can then access that innovation. So we're working on that on a daily basis. And the way that we do that is in 4 particular areas. So public policy, making sure state and federal level that folks are cooperating on that front. And in fact, this is what John will be talking about to a certain extent. And this is John's area of focus, and where, frankly, the intention is that the fellow will have some work to do in this area. Also, programming and networking. We know the number one reason that people come to BioNJ is to meet other people within the organization. And so we create in the neighborhood of 30 programs a year. Obviously this year online, but normally most of them are in person, and making sure that people can connect with capital. They can create collaborations with between large and small companies, and that mentorship is happening. We have a series of programs where our companies can save money because it takes, 2.6 billion in 10 to 12 years to bring a drug to market, according to Tufts. And so we want to help our companies save as much money as we can along the way. And then finally, talent services, professional development, entrepreneurs resources. This is one of the areas that Randy works in talent development, and then also helping our companies tell their stories, also helping us tell the story of the value of medical innovation and what a difference it makes for patients and for the economy and for global health. And so you'll be hearing again, because Randy and John are partnering on this fellowship, and you'll be hearing from Randy in a moment as well on her end of the bargain. So with that, I'm actually going to hand it over to John first, and Randy. They wrote the job description. So I think John's going to talk a little bit about that, and then you'll hear a little bit more about the intentions and the areas of work. And then again, as you know, we are more than happy to take your questions and get really into the dive in to the nuts and bolts of it, but not until we hear from John Ruland as well on his experience at BioNJ and his experience since then. So with that, I thank you for your kind attention, and I will hand it over to John Slotman.
Thanks, Debbie, and good to see everyone this morning. My name is John Slotman, and I am BioNJ's Vice President of Government Affairs. So what that means, obviously, that I spend a lot of time under normal circumstances actually physically in Trenton or in Washington, D.C., but in the last 10 months, obviously I've been in either. I've been close, but not quite there with both of those Capitol buildings, obviously not open for visitors. So you've obviously taken a look at our position description. I think if you're here, that probably means you've already looked at it. But I think in short, what we're talking about here would obviously give a real terrific opportunity to understand I think from a sort of an inside Trenton or inside DC perspective, kind of how the sausage gets made, right? So it's a great opportunity to learn a little bit more about how our the advocacy process, how we develop advocacy materials, what data goes into that, research on the back end, and then on the front end, how a bill goes through a committee process in both Washington and in Trenton, and some of those various issues. And I know we mentioned the position description. I mean, some of the focus could be specifically related to some of the cell and gene therapies that Debbie just mentioned, or we work with a lot of patient groups, doing some research and figuring out how we're working with those patient groups and how that interplays in with the policy and advocacy side of things. We're also, always interested in learning more about where we are here in New Jersey, where our members are, and where in terms of the legislators, where trying to sort of locate where they are. So, Debbie mentioned a bunch of a lot of the different things that have happened here in New Jersey, but I guess I would just mention, to augment that as well as repeat a little bit of it, is it's a really exciting time to be part of this industry. The last 10 months, I think, has really shown to a lot of folks who, they obviously at some point, we all go to the pharmacy and we pick up a treatment, or we have a relative who is going through a treatment, and we understand that at some point that those treatments came from the biopharmaceutical industry. But I think on the COVID side, we talk about a lot of the different things that our members have been doing from the research perspective, and And we talked about CAR T and some of the therapies and some of the real, like what I like to call sort of the Star Wars era of medicine, where just the science is just going so quickly, and we're developing cures to hepatitis C as an example, which there's a 90% cure rate, and just a decade ago that was those individuals were our system was spending somewhere close to $2 million over the course of an individual with hepatitis C's lifetime in institutional care. So and then we've also a lot of treatments. We do a lot of work with rare disease organizations as an example. And just in the last couple of years here, you've seen some real miracle therapies for disease states such as cystic fibrosis. Just I think 2 years ago now, the very first real treatment for the vast majority of the cystic fibrosis cases just was approved. And then issues such as spinal and muscular atrophy, which if you're able to treat it very early in life, it can be curative, as opposed to for those folks that suffer from SMA, it can be a really long, difficult process with lots of hospital and physician visits. And of course, COVID, which has really been exciting to be able to work with so many of our legislators on COVID issues. They're all so excited to learn about what our members are working on. So that's been really exciting for us. And then I guess I would just mention just a couple things in terms of some of the issues that we're working on right now, both in Trenton as well as in Washington. Washington, right now, there's a new administration coming in 9 days from now. So there is going to be so much activity on all levels, not just sort of the drug pricing discussion that we've obviously been very involved in, but we're going to have a new HHS secretary, a new CMS administrator, and I think we're going to see a lot of activity there. And I think that with our 12 members of Congress and 2 senators, we'll obviously be keeping very close tabs with them, and there'll be sort of a lot of ancillary work with the new administration and what we might see here in the next 6 months or so in terms of moving forward from the Trump to the Biden administration. And then in New Jersey, we continue to have a lot of sort of pro-patient issues that we're working on. As an example, I think you see on the screen here that we're really looking to make sure that our members of our legislature understand how important medical innovation is. So as an example, we're part of a coalition right now that's working on issues related to step therapy. And for those of you who don't know what step therapy is, it's the process that a lot of health plans will use for an individual. You go to your physician, you get a prescription for a particular treatment, but a lot of times the health plan will make you try out 1 or 2 or 3 or however many treatments that are less expensive before you get to the treatment that works for you best. We think that is a process that's obviously keeping a lot of patients from the treatments that they need when they need them most. So we're working with a really wide coalition of patient groups on that issue, and trying to make sure New Jersey has some sort of guidelines where they're able to use step therapy in an appropriate fashion. We're also working with a lot of our rare disease members, as well as a lot of rare disease patient groups. That includes NORD and some of the larger groups based down in DC. We are a couple items we're working on. One, we're in the process of planning a rare disease day in Trenton, which will be March 4th. And there's obviously a lot of background work on that to make sure that that sort of virtual event happens smoothly. But we're also working with our members and our patient advocate friends to put together a rare disease advisory council in the state of New Jersey here. So what that would be, an actual official government body in New Jersey that would advise our governor and our legislators on rare diseases, how we can improve patient access in New Jersey, how we can, if there's ways that we can do a better job with research here in New Jersey on rare diseases. So just a couple of issues that we're working on, and like I said, I think a lot of the issues are really covered specifically in the position description. But I think from my perspective, it's a really exciting opportunity if you're interested in sort of how how the policy and advocacy world operates. It's a really terrific opportunity to be involved in that, and especially in the biopharmaceutical industry where there's really so much activity right now specific to our world as well as health policy that really exciting time. Just, and I'm obviously biased on that point, but a really exciting time to sort of be part of the policymaking process, both here at our state capital, New Jersey, as well as in Washington. And with that, I think I am turning it over directly to Randy. Right, Randy?
Yes. Hi, everybody. Thanks, John. I'm Randy Bromberg. I'm Vice President of Communications and Marketing for BioNJ. And I'm really excited about working with Princeton on this opportunity. The things that really sort of fall into my area is working with our members, working with our state partners, and working with the community as a whole. A big portion of our communication plan is to really help educate and support our members and our patient groups to help them sort of move their missions forward. And we do that with a lot of educational and informative materials. I just have two examples up on the screen of when COVID came to the US. We were actually one of the first organizations to put together a toolkit for our members. Really everything changed on how to do business, how to move forward with so many things. And so we did a lot of research. We pulled together a lot of tools for the community, for our members. Debbie worked very closely with the governor and his task force. And this way we continue to educate and really support those in our community. And so, we do this on a daily basis, whether it's funding alerts, whether it's public policy alerts, things that are happening as John mentioned, in Trenton, in Washington, or just in our community. Our hope is to be able to support our members who really are from small to large. And so a lot of those that are smaller really rely on BioNJ to help them move forward. We do a number of surveys from my group to the industry to help pull together best practices that others can learn from. And so it's something that we're proud of, something that's exciting, and something that this position in particular will really help support. I would just sort of lay the foundation that what is really fun from my perspective, at least, is that every day is something new. Every day is something exciting because our industry really, is doing some amazing things to change the world and change the lifestyles of many patients, giving them hope. And so part of it, as I mentioned, is the education side, pulling together tools and articles and primers, and so on. And now that, there's vaccines coming into the marketplace, we are priding ourselves in really helping to educate the communication about that. And that's something else that we'll be working on in great detail over the next few months, probably long into, the fall as the vaccine plan gets rolled out. But it's really educating on the safety and the purpose of vaccines and how it's really changed the world in so many ways and the importance of it. So I put that out there since it is such a big part of what we work on these days. Over the last 2 years in particular, John mentioned that we work on the value of medical innovation, and we launched a campaign with the support of our members to really help educate legislators, advocates, our members, the community. As you'll see, there's obviously a theme going on. And it's to explain the impact of what our industry is doing and how some policies and some frameworks around how pricing is determined through the insurance companies and what patients pay at the pharmacy are determined. So it's very important to make sure that those are educated and that we help support good policies that benefit and bring to light some policies that are out there that may not be doing justice for our patients, to make sure that they are able to have access to what they need when they need it. And so that really, we've done that, as you'll see, just some examples with op-eds, with articles, we have an online toolkit in this area as well. And so once again, just turning back to this position in general, This individual will be very active in doing research, in doing writing, and coming up with creative ways to educate. It's very empowering and inspirational and exciting. And there's a lot of eyes on the work that we do. So I do like to draw that out because I think that is, very powerful to the position and BioNJ as a whole, is that, it is extremely inspirational every day. We work very closely, as Debbie mentioned, with the state, our partners at Choose New Jersey and the New Jersey EDA, to really showcase what our members are doing, what is available in the state for life sciences organizations. We are actually hosting an event on Thursday with our partners in China to really explain how, we work with others in many states and other countries, and how innovation is brought forward with those partnerships. We definitely work with the governor's office on incentives and many other areas that will help strengthen the economy and the life sciences industry within that economy. And once again, what I do with my team is really help BioNJ prepare for interviews, write educational materials, that are published and that are used by not only us, but our partners within the state to help tell our message. It's a lot of statistics that we report on and that we gather. And so I think that overall you can sort of see that we're on the back end of the front of BioNJ. So my part of what we do is really help to bring that messaging together. And I look forward to working with the candidate who's interested in doing this to move this forward. And with that, I kept it short and sweet, because I'm sure that, hopefully I can answer some thoughts, and your questions at the end. But I'll hand it back over to Amy, who can introduce John, who was a fellow in the past and will bring some light to everything that we've been speaking about. So thank you.
Thanks, Randy. Yeah, so it's a real pleasure to introduce John Ruland, star 13, as we say at Princeton, who completed his PhD in the English department and was really the first Princeton fellow at BioNJ. And so John's had an amazing career since that time, at the time he left Princeton, and he's going to share a little bit about his experience with BioNJ and a little bit about his current work and his trajectory to get there. So John, thanks for joining us. It's always great to see you and reconnect with you here.
Yeah, thanks for inviting me, Amy. Great to see you, Debbie, and everyone. Great to see you guys too. Amy and Debbie were really instrumental in different ways in helping me launch my career when I was leaving Princeton. I did my PhD in English here, defended in 2013. And then sort of made a transition into the biopharma industry. Right now, I am leader of access communications at Janssen Pharmaceuticals, which is part of Johnson & Johnson. Essentially, that means that I lead communications and public affairs efforts for issues related to patient access and the value of medicines. So some of the things that John described, like step therapy, some of the things that Randy described, like the attempts to value medicines sort of other than sort of what the market will bear or what payers will pay for them. The key thing about my role is that I try to educate different stakeholders around in policy, in the media, about who's really responsible for the price of medicines. And so, typically what we try to talk about is the way that insurance companies and insurance coverage really determines what patients will pay out of pocket. And I when I think of what my current role is, I say it's communications and public affairs. I think that really does boil down to research and writing. It's research into trying to understand sort of what are the core issues in the policy and business landscape, and then writing cogent arguments about how the business environment intersects with the policy environment in a way that will be beneficial or not beneficial to patients and the development of medicines in the future. I got started at BioNJ in 2012. So I think, really that was the summer as I was kind of wrapping up my dissertation and getting ready to defend. It was at BioNJ that I learned a lot about really what the sort of what this intersection of business and policy looked like. Because I worked on two core projects. The first had to do with biosimilars, and the second had to do with mapping state incentives for preserving biotech innovation. So, biosimilars are like they are the medicines that are like the originator biologics that cell and gene therapy companies develop, but they're copies they're chemical copies or biological copies, excuse me, made once a medicine goes off patent. The Affordable Care Act enabled a regulatory pathway for biosimilar development in the United States. And at the time, that was just getting underway as the Affordable Care Act, signed in 2010, was being rolled out. So part of what I did was help develop BioNJ's position statement on what regulating biosimilars would look like. I also created a map or a spreadsheet full of different incentives in, well, for lack of a better word, competing states. So if we're talking about trying to attract biotech investment and you're a company trying to decide whether to bring your R&D to Boston, Texas, or New Jersey, what are the different incentive plans that a state could put together to make that a better or worse proposition for a company? So I learned a lot at BioNJ that was really helpful to my subsequent career. But I think it would be, I remember when I was in grad school, it was really helpful to kind of understand how people got to where they are. So I met Debbie, and through Debbie, kind of joined BioNJ for the summer of 2012. After going to an event like this, I met a man named Todd Brady, who was a member of the BioNJ board at the time. And I don't know if he's still part of BioNJ, but he and I had coffee at Small World when it was still possible to do that in person. He introduced me to Debbie. I met Debbie, and then through the BioNJ internship or fellowship, I met a lot of people who were instrumental to my career, including somebody who I began to freelance for or be a contractor for while I was defending, and sort of after I defended and was looking for a job. Through that role, I came into my next role, which was working for a company called Taft Communications. And then through just Taft Communications, I came to Janssen. So I think, so subject matter knowledge and learning about biotech for me was very important, and one of the more important things that I gained at BioNJ. I think the other thing that proved to be at least as important was just being able to meet a lot of very important people in the industry. So when I look back, I realized, I had a lot of great opportunities to have coffee and conversations with CEOs of biotech companies. I met somebody named Perry Carson, who at the time I think was chief scientific officer of Celgene, and I think he's since moved on. I met the CEO of Amicus Therapeutics over in Cranberry, and building those relationships was really helpful for me to kind of as I took steps. I think it did. It gave me a chance to kind of learn what it was to speak to people in the industry. Sort of when you're in academia, you know how to talk to people in academia. This just helped me have multiple conversations where I was forced to articulate the type of value that a humanities background brought to a potential career in biotech. And when I think about, what is that background? What does that background deliver for my current role? I mean, I tend to think that the most important thing you can do with the humanities background, and I don't know if the people from Princeton and what departments you're coming from, but in the humanities, I think the most important thing you can do is bring context. So you can gather lots of information and then create a context in which people can make better decisions. So if we're thinking about, they're the implications of step therapy for the marketplace. Or what people with humanities background can do is kind of understand, okay, well, so this is going on in the business landscape. This is the reason that United Healthcare might want to put a step therapy protocol into their certain employer plans. But also, this is what's going on at the state level, and this is what's going on in the federal level. And I think having a humanities background helps you bring together the multiple aspects of a problem, or the multiple dimensions you would need to address a problem. And I would make one other pitch for working for big pharma in the biopharmaceutical industry, is that it's very multidisciplinary. So, science is one thing, and kind of science is the core of it. But when you expand beyond R&D and into the commercial environment, I deal every day with doctors and scientists, but also with lawyers, with MBAs, with people with policy degrees. So it ends up being, and one of the ways that I think it's a little bit like academia is that it ends up being fairly multidisciplinary. There is always that challenge of being able to think through, okay, well, we understand what the implications of talking about sort of rebate reform, say, sort of the rebates that biopharmaceutical companies pay back to payers in order to have their drugs covered. It's one thing to have that conversation with the lawyer. It's another thing to have that conversation with a doctor, or with somebody who's in charge of getting pharmaceutical products reimbursed by payers. So I think, in general, I think the core thing, it was a really great experience at BioNJ to kind of get really quickly immersed in the intersection of business and policy, and also network. The opportunities to meet, major companies are represented on the biotech board. Not only major companies, but also people who provide services to those companies. So consulting firms and everybody who's involved in the biotech industry in New Jersey is involved with BioNJ. And I think it's very important to, it's very important to make those connections, or take advantage of those opportunities from the position of a fellowship. I would say that I think, that just in terms of subject matter, policy and health policy and advocacy are just some of the most interesting and kinetic or dynamic aspects of biotech right now. As John mentioned, the administration is changing. There's a lot of attention given to the affordability of healthcare, not just drugs, but also healthcare in general. And then that's all happening at the federal level. And then the other thing I would say is that it gets even more interesting and more crazy when you go to the state level, because over the last couple years, even as the Trump administration has made some attempts at drug price legislation, it hasn't been terribly successful. So you see a lot of experimentation at the state level, where Massachusetts is trying a lot of things to bring the cost of care under control. States like Maryland are, but then you also see states where there isn't much action. There's kind of, in our divided government and sort of divided country, states have really taken up the mantle of reforming healthcare, and it becomes interesting and complex, and a subject that requires a lot of attention, and I think a lot of thought. So I'll stop there, but I would just make the case to BioNJ, learn everything you can about policy and the industry, and then take advantage of networking.